Hello, my name is Martin Lipscomb, and in this conversation I'm joined by Associate Professor Graham McCaffrey. Graham works at the University of Calgary in Alberta, Canada. His work, which is wide-ranging, has focused on mental health, staff-patient interactions, humanism, childbirth, intercultural studies, cancer, and qualitative research. He has also recently published a book with Routledge titled Nursing and Humanities. However, today I'd like to talk to Graham about his interest in hermeneutics, and in particular, philosophic hermeneutics. So please, Graham, what is philosophic hermeneutics? How might this thing influence us in undertaking research, and how might it help us make sense of research?
Okay, well, first of all, thank you, Dr. Lipscomb, for inviting me to talk about hermeneutics. Perhaps I should start by kind of giving a little bit of background as to how I came across hermeneutics. Before I became a nurse many years ago, I did a history degree. And it was only when I came to do graduate studies after a long clinical career in mental health nursing, that I realized kind of how much that had marked my way of thinking, that kind of early training in a particular discipline had marked my way of thinking. And then when I came to want to study the topic of what I had come to realize were some of the problems and challenges in nurse-patient relationship on acute care mental health units, particularly in the context of acute care mental health units. I came to graduate school rather naively, knowing that that's what I wanted to study. I developed an interest in Zen Buddhism and knew that I wanted to somehow bring insights from that tradition, from Buddhist thought to bear on the topic. And it was only when I started doing my courses that I came across this thing called hermeneutics or philosophical hermeneutics, being taught as an approach to research. And to me, it was a natural fit, both with my topic and with my disposition. And as I go on to explain more about what it is, the reasons for that will become clearer, I think. So to very briefly sketch the background to it, it's really, what we talk about as hermeneutics. And the philosophical I always think of as a bit of as not sort of an entirely necessary sort of qualifier to it. As long as we understand what we're talking about is a philosophical movement that arose in the late 20th century. And the leading figure, not the only one by any means, but the leading figure who I'll concentrate on is a German philosopher called Hans-Georg Gadamer. And I won't go into the historical antecedents to his hermeneutic philosophy, except to say that he was a student of Heidegger. So there's a very distinct stamp of phenomenology and of Heidegger's concern about being in the world and how we make our way around in the world that comes through in Gadamer's hermeneutics. So really what he was interested in, and his signal work was called Truth and Method. Apparently that was not what he wanted to call the book originally. His publisher told him he had to come up with a jazzier title than, I think he wanted to call it Philosophical Hermeneutics. So he came up with Truth and Method, which does make an important point, that what he's trying to do is work out how it is we make sense of the world, and how it is we can say something rigorous and sensible and purposeful about all those aspects of human life which don't really lend themselves to scientific investigation. That's the method part of Truth and Method. So it's by no means a book of relativism or of anti-scientific thinking, but he's interested in all these realms of life, as I say, that don't lend themselves to those kind of rigorous methods of scientific investigation that rely on objectivity and being replicable and so on and so forth. So you can already see how this is going to fall into the quantitative-qualitative research divide. So that's what he was interested in, and some of his key concepts. And as I go through these, I hope it becomes obvious kind of why there are distinct affinities, I think, with nursing and with research in nursing. One of his key concepts in trying to understand how it is that we understand, and when he talks about that, he's not thinking of it as some kind of cognitive procedure that we undertake, once in a while when we want to solve a particular problem. But as the fundamental way, some fundamental aspect of, as I say, of how we make sense of ourselves and the sense of the world as human beings that we're constantly interpreting. That would be one of his fundamental insights. And for him, to me, the most significant element in his thought, which is really what distinguishes him, I think, most significantly from Heidegger, is that he uses this motif of conversation. And it comes up in all kinds of different ways in his thought, some of them more complicated, more technical. There's a term that people may have heard, the hermeneutic circle, or the fusion of horizons is a phrase of his. He talks about play, where he emphasizes the back and forth that goes on in play. He apparently was a keen tennis player, and that's a kind of helpful way to visualize what he's talking about when he talks about play, I think. But the central motif is really conversation. And interestingly, sometimes he means it kind of symbolically or metaphorically, but often he means it literally, two people talking to each other. And he says that's the basic motor of understanding, and how it is that we can learn new things about the world and understand differently. He's not saying that we automatically do when we enter into conversation. It's something that has to be sort of struggled for and achieved. But when it happens, this is how it happens, because if we enter into a conversation where we are as much available to listen as we are to speak, and to pay attention to what the other person is telling us, then there's a possibility that we can shift our understanding, that we can take in something new. And he's not saying that that has to end up in agreement, or that one person has to win the conversation, but that the understanding shifts, and that the understanding will shift for both partners. So if I can give an example from my clinical work, where when I think back, I could see this happening. My last clinical job was working in psychiatry consultation liaison. So we would get referrals out of a printer in the morning of where somebody somewhere in the hospital on a medical or surgical unit thought there was a mental health problem of some kind and wanted an assessment. And I would often read after I'd be doing this work for a few months, I would often read the referral and think, oh yes, depression, that old story again. I know what this is going to be. And of course, by the time I got to the unit, started looking through the chart, and my understanding would shift as I gained a bit more information. Perhaps my understanding would shift as I found an absence of charting, an absence of reference to what the supposed problem was. And then, of course, it would really shift when I actually met the person and understood what their particular circumstances were, and not just what the diagnosis might be, but what their experience of being in hospital was like, and the particular ways that was bearing down on them, and the particular worries that they had. And began to think with them about, within the limitations of them being in hospital, how we might be able to help them with that, beyond going away to talk to the psychiatrist who might prescribe an antidepressant. But that's part of the picture too. It's not to exclude that. So that I think, as I say, thinking back is quite a good example of how understanding expands through this dialogic process, and it's not just the literal conversation, but the dialogue with the text of the initial referral, and the text of what's written in the chart, and the differences between what physicians write in charts and what nurses write in charts, and a sensitivity to all of those things. So it's really a philosophy of tremendous sensitivity towards how we understand, and how we understand in dialogue. And another really important elements in his thought, this is by no means comprehensive, but another couple of elements that I think are really important to understand the applicability to research. One that he emphasized, that we're historical beings in such a way that we are really influenced by our histories. And that's history in all kinds of ways. And increasingly, certainly here in Canada, I imagine this is international, in mental health, we're becoming much more aware of trauma-informed care, giving much more emphasis to the significance of attachment theory and early attachment, which is not new. As you know, that John Bowlby was the pioneer of that theory sort of decades ago in the UK. But it's certainly sort of come back in a big way. So that way of thinking about things. So there's that sense of personal theory, personal history, as to what happens to us early in life matters as to how we manifest ourselves later on in life. But there's also the element of sort of our cultural history and our cultural background. In the way I nurse, I know I've been influenced by my training initially in the UK, sort of under the old dispensation, pre-Project 2000, pre-university nurse education. And then again, in graduate education, I kind of realized how much of a stamp this had left on me, that I worked at a therapeutic community called the Castle Hospital just outside of Richmond, which is a very, still going, but a very unusual model of care in that it came out of or in its modern incarnation, it came out of the great advances in group psychotherapy after World War II, working with troops who we would now say had PTSD. There was a model of psychosocial nursing, which put all the emphasis on talking. We would actually wean patients off psychotropic medications, which sort of now I'm more used to more conventional inpatient care is really quite startling. So my way of thinking about mental health nursing has very much been marked by that. So when I come into an encounter with a patient, I may not be consciously thinking about that, but that's part of the history. That's part of the horizon I bring with me into that exchange. So that's part of Gadamer's understanding that what happens to us in the past forms us in significant ways. And of course, ways that we're mostly not conscious of. But if we choose to, we can turn around and attend to. So a good example of that came out, I worked with a graduate student who was a labor and delivery nurse who, not my area of expertise, I co-supervised with someone whose area of expertise it was. And she became interested in the phenomenon of women who chose to have cesarean delivery without a medical indication. And I think they say it in Canada too. I know the British sort of rather pejorative catchphrase is too posh to push. And she became sort of troubled by precisely that, by that kind of judgmental assumption about the women that were choosing this. And so there were two interesting things that for me that came out of her doing a hermeneutics study. One was that interviewing a small number of women, because it's a qualitative method and unashamedly has small numbers of participants, with just the range of different kinds of meanings that the choice of cesarean had for different women. So in other words, what had formed their historical horizons that brought them to that choice. Another aspect of what she did was recognizing the institutional power, that the women only had the choice as long as they could find an obstetrician who let them have the choice. So it was really important to note that there were gatekeepers. So when healthcare professionals, and she had instances of this, were making snide remarks to the women as they came in to give birth, it was really they were really talking to the wrong person. It was the obstetrician that they should have been protesting to if they didn't like it. But another thing she did was look at the historical horizon of women's choice, and how that had extended throughout the 20th century, Starting with the franchise, with the women entering into the workplace, with the rise of consumerism, how that affected women's roles, how that kind of consumerism, choice and expectation had entered into healthcare, again, which had created this cultural space of choice that these women was there before these women came along and decided to make a choice in their own right. So it gave you a sort of a much more nuanced and broader, contextualized understanding. That's what I think hermeneutics lets you into really well, because it does have this historical perspective. It does really focus in on the expansion of understanding, but it's also about following leads. One of the big differences between hermeneutics, and I don't think this is emphasized enough, one of the big differences between hermeneutics in research and phenomenology in research is that hermeneutics is, I always describe it as divergent rather than convergent. You're not trying to focus in on the lived experience and somehow exclude everything else, but you're recognizing that the phenomenon of interest, the topic, that there is a lived experience at the heart of that, but that it's invariably entangled in all kinds of historical and contextual factors. And that when you start investigating that, it's incumbent upon you as a researcher, and this goes back to Gadamer's original impetus to say something sort of rigorous and purposeful, that you have to find a way of choosing which of these entanglements you think, which threads are worth pulling on that will actually tell you and will tell practitioners something new, or provide some new insight about the topic, which might help them to practice differently, which might help the next labour and delivery nurse to bite their tongue and not say something pejorative to the woman who's come in from elective cesarean,
Okay.
for example.
Can I interrupt you there just for a second?
Sure.
From my own reading of Gadamer, one of the things I thought was quite interesting was his critique of method as a way of reaching truth. So certainly in my own teaching, when I'm introducing students to research, methodologies, etc., there can be, although I try not to, but there can be an assumption that if the researcher has followed the appropriate method, truth drops out at the bottom in some fashion. And I read Gadamer as challenging that, not in an anarchic way. He wasn't just shouting, there is no method, it's imagination and insight. But he certainly does critique, doesn't he, the idea that if we merely follow the correct methods, we'll attain truth. And for researchers, I think that can be quite a challenging notion.
Yes, and I think of it, I think another of his great themes is language and the ways in which it's very difficult to sort of achieve sort of final definitive meaning in language. And that's both kind of a tragic necessity, but also a kind of creative opportunity. There's also something rather sort of wonderful in that we keep striving to make ourselves clear. And there are certainly degrees of that. We can make ourselves clearer.
But again, the challenge is quite formidable, isn't it? Because he's not merely saying that we can't operationalise. He's saying there's something more fundamental there. So lots of terms might be woolly or vague, but he's saying there's more to it than from a researcher perspective or for someone reading research, that you really have to operationalise your terms. He's saying there's something deeper, that in fact these terms often can never quite be pinned down. Is that right?
I think it is, yes. But it doesn't mean to say that we have to abandon them or that we can't be quite clear about how we're using them, as long as we don't think that our usage happens, as long as we're not claiming that that's the definitive last word. There's always this, the conversation, again, this is another sort of important principle, the conversation is always endless. So one's 200-page thesis that you've sweated over to complete to the best of your ability, is if it's a topic that's worth talking about, is just one contribution in an ongoing conversation. So with the idea of method, it's not that we can or should particularly sort of ban the word or let go of the word, but I think we do have to kind of loosen it up in a certain sense. So I'm the excuse me, I'm the co-author with my colleague Nancy Mouls, who was my mentor and teacher in hermeneutics, and really did a lot of work at the University of Calgary to set out how to do hermeneutic research. So although there's this kind of wariness about method, I've just finished teaching a course where we tell students how to do hermeneutic research. So we're doing that at the same time as we're saying it's different from scientific method. And I think I find that kind of difficult to grasp, because I think it is that there's a kind of a dance that goes on. But I think there are principles, and one of the interesting things I find about hermeneutic studies is that they do come out looking like lots of different things, and that's where I think you can see the difference between a completely prescribed method, where the proof of the rigor and the proof it's done well is that you can absolutely tell that the steps were followed properly. With a hermeneutic study, where the results might look quite different, because each researcher has come at it with their own horizon of experience and capabilities. Each topic demands something different. And to give an example of that, I worked with a student, a mental health nurse, who had been seconded to work with people in the wake of, I don't know if the people in the UK would remember this, but there was a huge forest fire in northern Alberta a few years ago that destroyed large parts of a town called Fort McMurray. And she went there to give mental health support to people in Fort McMurray in the aftermath of the fire. And was very affected by this experience, and then went back to talk to a group of teachers she'd met at the time a year later. And when she came to look at her data, to look at her interview transcripts, and she was looking for, what should the interpretation be? But what was really overwhelming was the way in which these people who she'd interviewed independently were really compelled to tell the story, because it was obviously partly a way of processing the trauma of the event. That they were really compelled to tell the story of what happened. And there was a kind of a communal bonding that was going on as they all told the story, but in each rendition of it, there were common elements. There was a particularly heroic teacher who had really sort of gone beyond the call of sort of everyday demands to look after a couple of students. There was a kind of villain of the piece, who was the sort of bureaucrat in the school system. So that became what she wrote about. So there was a strong narrative element to what she wrote, which you wouldn't normally see in most hermeneutic studies. So that would be an example. It adhered to the principles. It was a good hermeneutic study, but it looked very different to say the study about the caesareans by maternal choice.
Okay. Before we wrap up, can I just ask you, take you back a little bit, because I think it does follow on from what you were just saying about understanding in a particular instance. You mentioned earlier Gadamer's interest in history, and he also uses the word prejudice to mean prejudgment. When we try to understand in the human and moral sciences, we're doing so from within a set of structures which influence our understanding to begin with, and that's the thing we're trying to understand. Now, many researchers, quantitative and also qualitative, more qualitative than quant, but both, are interested in situating themselves within their own research, particularly when it comes to identifying values and mores that might influence what they're doing. But Gadamer's challenge seems to undercut their ability to do that, because of course they're trying to understand their own thinking, their own values and their own ideas from within the frame that they're trying to understand. If what I've said makes any sense, what do you think?
I agree with you. I think you're right. And I sometimes see in hermeneutic studies these rather sort of declarative statements at the beginning that you know, I belong to such a category and another kind of category, and this influenced. But there's not really any attempt to explain why those categories influence the findings or influence the way the research was done. So I think hermeneutics enjoins a lot of humility, which is, for me, is one of the sort of intellectually attractive things about it. And that's one of the things where we need some humility. Although we can strive to understand where we're coming from, and I've kind of given some examples of that in my own case, we always have to be cautious about how partial that understanding is. The Gadamer's word is finitude, the finitude of understanding, and that's one way it comes up. Which again is another reason for this sort of imperative of the dialogue, that we go on putting these things into dialogue. So in the hope that we can go on achieving some kind of refinement or understanding. Another thing is the relevance of it. And again, one of the things that hermeneutics is often accused of is being overly subjective. And I really don't think it is, because there is an interest in what's going on out there in the world. And yes, I'm involved with it. As a researcher, I'm involved with what I'm doing. I'm probably, if I'm going to do interviews, I'm probably going to talk to participants. Well, I am going to talk to participants who I know have a close involvement in whatever it is I'm interested in. But I'm not going to assume that what they tell me is the whole story. Because it is something that happens out there in the world, and there are these sort of institutional imperatives that influence how people think and how people act. And we can do our best to understand those, and we can invoke all kinds of different things to give us some leverage, I think, to open up understanding, so that our own disciplinary literature is important. We don't pretend that we don't know about that. Different kinds of theory from different disciplines can be important if it gives us some leverage to shed some new light on whatever it is we're trying to understand better. So I agree with you that I think those rather sort of blunt declarative statements of identity don't actually help very much. I think if we are going to say something about our involvement in the topic, it needs to be done with sort of care and caution, and the understanding that it may be of some help, but likely of fairly limited help.
Graham, that was really, really interesting. Thank you for your time. Let's wrap it up there. And I hope people find this of value. Thank you very much.
Thank you.